So I just want to welcome everyone to the first roundtable discussion of the group care community of practice. And before I hand over to Margie to do a bit of an opener, I just want to say that this is all a bit of learning all around, which is what I feel like groups always are, where we're trying to share knowledge and experience and learn from each other to figure out what works, and if it doesn't work, what can we do to make it work. That's sort of always my goal. And I think sometimes we sort of chose today's topic based on the fact that I think many of us in the world are very enthusiastic about group care, and yet making it a reality in practice is challenging for a whole host of reasons. And I think some of it has to do with personal fears, and some of it has to do with professional, and some of it's systemic. And so I'm sort of hoping that we can tackle all those things today, in a variety of ways. But I'm going to stop there and hand over to Margie Rickel, and then I'm sure she'll catch up with introductions so that everybody knows who they are too.
And good morning, I'm Margie Rickel, and I was once upon a time very scared to do group care. And I sometimes am scared even today about some things. So, oh look, there's Octavia too. Octavia, good to see you. And I thought we would do a quick opening just to hear everybody's voice, no long stuff. First name and I don't know, first name and what you like best about this time of year, wherever you are, because it's hot and it's long and it's whatever, it's wherever you are. And if we can just say your name, what you like best about this time of year, and then call on somebody else if you would, and we'll get everybody voice into the circle, the virtual circle. And what I like best about this time of year is Thanksgiving. And I'm going to call on Octavia. Your mic's off, Octavia, so you can speak.
Hi, everyone. I'm Octavia, and I'm really glad you said Thanksgiving, because I love Thanksgiving. And although I'm American, I was never brought up with it, but I've started doing it late in life, and it's absolutely my favorite thing. Way better than Christmas, as far as I'm concerned. So I'm sorry, I'm just going to second you. Thanks a lot, Margie. Manoj.
Hi, I'm Manoj. I'm from Perisur in Suriname. I'm one of the researchers. And what I like best in this time of the year is December, because in Suriname, we built up a lot of excitement moving towards the end of the year with lots of dinners, parties, and festivities. So we already feel the vibe. So I like it. Okay.
I want to call on somebody, Manoj.
Morwena?
Hi, my name is Morwena, and I would say, the thing I enjoy the most about this time of the year is that I know I get to see my family this month, which is always a really nice feeling. Yeah, and spending time with I think it's a time, like you said, that is very much about being, having events and being with family and friends. Yeah.
Thank you, Morwena. Can you call on somebody?
I'll call on Deborah.
Hello, everyone. My name is Deborah, or Debbie, and echo what everyone else said. And where I live, the leaves on the trees change color to these brilliant reds and oranges and yellows, and it's quite amazing. So I love that. And I will call on Jadidia.
Hi, my name is Jadidia. And what I like about this time of the year is the Christmassy feeling. In my part of the world, we know nothing about Thanksgiving, but here it's kind of the Christmas of the American. So for us here is the Christmassy feeling, getting to meet people, getting to unwind, and then to kind of have a bit of a party feeling. I think so.
Thanks, Didier. Can you call on somebody else, or I will do it for you? Fatima, can you
Fatima.
come off mic? Huh?
Yes. Hi, I'm
Thank you.
Fatima. I'm an undergrad here at Hopkins, in the US. And my favorite part of December is it's gonna be winter break for us soon. Oops, sorry. It's gonna be winter break for us soon, which means the semester's finally over. Yeah, Marcia, do you mind calling on someone for me? I'm not really too familiar with the group just yet.
Just anybody who hasn't gone yet, Fatima.
I don't think Dr. E has gone.
Dr. E. Capito. Thank
Not
you.
yet. Thank
Not
you.
yet.
Yes, I'm Esna from Blantyre, Malawi. And what I like most about this season, it's a season of celebrations as we commemorate Christmas. For the holidays, we meet families. So it's so exciting to be in this season. Thank you.
Thank you.
And
Marlene.
I'll call upon Jalana.
Oh, thank you. I am currently at the moment, I'm in Ohio in the United States, and my favorite part of the season of December, well, people put up lights all over the place here, and I have to say that I'm really, I love lights. I grew up with lots of different holiday traditions, but I love lights is a nice unifying one that puts a lot of them together. So I really love seeing the different colored lights all over the place, and candles and windows and all kinds of different lights. It's really lovely. So that's my favorite part so far. And now I'd like to call on, I see both all of the Dutch have put themselves in one screen. No, wouldn't that be impressive?
We're used to small spaces, small countries. I definitely second Thanksgiving. I cooked more than 6 kilo turkey this year for an American friend. But what I like most about this time of the year is all the sweets, like pepernoten, pepper nuts. They're like small biscuits, very traditional around the 5th of December. They're very good. So they're supplying us at work. Yeah, we're in the Netherlands. That's it, right? And then I like the 5th of December because that's our Santa Claus, which is a horrible feast traditionally wise. But then you have to make these poems for people, and you have to wrap the gift in you make a surprise out of it. So, and that is very amazing what people do to you and what you can do to others. It's very nice. All the anger of all the year can come out.
They're gag gifts. I just found out yesterday they're not Christmas presents. They're like gag gifts and poems. And it's, anyway, that's neither here nor there. I won't digress. Thank you, Marlies. Over to you, Jelana. That's everybody, I think.
Great. Yeah. Well, thank you. I really think that's just it's so interesting and lovely to hear about everybody's holidays. And I think Jedidia, just to say, Americans always latch on to Thanksgiving, but I think it's interesting to see that there's similarities in all of these holidays across all of the different spots. So finding ways to get together with friends and family and having parties, I think, is always our big unifying factor among many of them. I am trying today to just be more of a representative of my own experience as a facilitator of group care in the US. So I'm going to hand off to Debbie to sort of kick us off on the topic of facing group care fears.
Okay, thank you. And I'm just going to ask if everyone, if you're able to either change your name to say where you're from, maybe your organization. If that's complicated, just put it in the chat so that we have that for people who will be viewing this later on. So, well, thanks everyone for being here. And I think that as we meet as a group, sort of modeling good group care behavior, we're going to start off with a question of when you think about group care, what appealed to you personally and or professionally? You know, why are you involved? What really moves you in terms of being involved in group care? And I'll just open it to the group, whoever would like to start.
Yeah, so for me, what appeals to me when it comes to group care is to kind of see or kind of move from the tendency of being someone that gives all the information to sitting back, listening to others, understanding their wealth of experience, and then together you are able to find solutions to typical health issues.
Thanks, Jedidia. Who else would like to comment on this? What appealed to you? What motivated you to get involved?
I'll go if you want.
Sounds great.
I'm a midwife by training, and I think at the core of it is absolutely loving the idea of getting women into a room together. I just think it's great. And I've always loved, you know, founding our care in relational care. So that's really good. I've got to run and get the door, sorry.
Manoush, what about from your perspective? What motivates you?
Yeah, so I am not a facilitator. I've never worked with women, especially not pregnant women. I'm more like an overall manager. But what made me what I found so exciting was having the women together and sort of, you know, see if they would open up. And I would say that this was sort of, maybe it's a combination of professional fears and personal fears. Like, if you have women together, will it be a success story? Will they really open up? Are they willing to speak about maybe private matters, personal issues? And I'm from a small country where, you know, like socially people, you know, might be a little bit afraid to talk about things that they might be afraid that others will talk about in a few hours, maybe after they've said something, and that maybe they would be shy or hesitating to talk about. So I have to admit that that was a sort of fear for me, whether it would be a success or that everybody would just sit and be quiet and waiting for others to talk. But I overcame my fears. It is a success. Mm-hmm.
That's great. And Manoush, we'll be talking about, let's get deeper into, you know, how that was addressed or what your observations are in the next round of questions. Yeah, Moreno, what about you from the Zanzibar perspective?
Well, I was very fortunate enough to work for an organization that had already taken on group care. So something that I learned about when I started working there. But I think something that a few weeks ago we were in the field and there was this moment and I was like, this is what it's all about. It was just one of the group care sessions, and the women were there were like 5 women in the corner and they were checking their blood pressure. But it was just watching it was so amazing. One woman was saying, no, that's not how you do it. You have to put your hand like this. You have to do it like that. And then another woman's like, no, you know, and it was this whole, it was so beautiful to watch how they had really they had become actors or how to say that? Is it actors? Is that the word? They had taken on the responsibility for their own health. You know, they had said like, okay, we know, I don't know how, is it actors of their own healthcare? And I think that for me is just something that I love. I love watching how their confidence grows about knowledge about their own body, and also to collectively the way that they work together, and there's that sisterhood as well that's really strongly felt. I think for me that's what I love, a lot about group care.
Esnath, what about you from the Malawi experience?
Okay, thank you. For me, I'm a midwife, but I came to know about group care when I joined the group care project, antenatal group care project, as a coordinator. So that was the very first time that group care was being introduced in Malawi. And we had a training about this. Two people from the US came to train us on group antenatal care. That's when we came to know about it. So in fact, it was a 5-year implementation project from 2019 to this year. So when we were actually going to implement this, there were so many fears among the midwives, because they were not certain whether this would work or not, because we had been used to the routine antenatal care where there are a lot of women gathering together and they are given health talk, and then later on they are assessed. And because there are so many with few midwives available to take care of them, they just they miss some of the steps that are supposed to take every time that they meet the women. So with group care, when it came, midwives liked it a lot, because it was like promoting a lot of time meeting with the women, interface meetings, discussing issues, and empowering the women to check their blood pressure and take their weights of each other. And it was so exciting for the women as well as the midwives. But the fears were because they didn't have that much confidence, and it was a new thing. And even in the community, we had a great challenge, a very big challenge, because there were so many rumors around. They thought it was satanic. They want to suck blood from the women. So we received negativity from the public, until when we started having meetings with the local leaders to prepare them about this new type of antenatal care. And now I can say that the rumors have gone, and it's so exciting. People like it, the women like it, the midwives, they are able also to do whatever they are supposed to do with a small number of women, and that gives them also satisfaction, job satisfaction. So I think I can start with that. So it was more of the midwives themselves having fear of the unknown, and also the women themselves. They really need to have courage to accept to be in the group antenatal care. But when they did, they were so thankful, grateful that they joined. And because other women were able to see the others that had joined and the benefits that they were having, then it was now better that women were joining in large groups, and they were even demanding for group antenatal care. So I think that's what I can say now.
That's exciting to transition from fears and reservations to demanding group care. That's very exciting. So let's skip to the US, then Netherlands, then back to the US. So Margie, you've been doing this for a while now. So what about when you think back, you know, and when you started, and what's kept you involved?
Well, I liked the idea from the very beginning, and just as a midwife, I liked the idea from the very, very beginning. And I really thought, well, I would like to do that. I just like the idea of having people in group. But I was scared about all the things, lots of things. I was scared that I wouldn't be able to keep up with all the patients' problems and issues that I wouldn't be able to keep up with all of that. And I might miss something, and I would lose that piece, that professional piece. I was scared that I would do that, and it ended up that I didn't. But I thought, I've got to tell you this, I thought that when I became a midwife, I came a midwife late in life, I thought I knew everything that any pregnant woman could possibly need to know, because I'd been a childbirth educator and a labor and delivery nurse, and now I'm a midwife, and I just knew. I mean, I was so confident I knew everything. And group care was the most humbling experience for me. I just learned very, very early that the women know more than I do, because they're young and pregnant. I was older and knowledgeable, but it was a really humbling experience for me, because I learned from them. And watching people go from being quiet and introverted to talking and changing the way they think about things without even trying. Just by talking to each other, they change. It's kept me going, and I like to think I'm changing the world one circle at a time. Anyway, putting people in circles so they can grow together. Thanks, Debbie.
Thanks, Margie. Okay, back on over to the Netherlands with Marlies and Suze, and then we'll end with Jelana. And just want to welcome Dr. Radia from Wajamama, who just joined us, Zanzibar. Okay, Marlies and Suze.
Okay. What I like is, I was the knight on the white horse. I saved women, that kind of thing, which was very, very rewarding when it went right, and very, very scary when it didn't turn out so good. And I really like that that responsibility of that feeling that you have to fix everything in life. That's gone. So that you do it with women. And because also I'll be gone after care, I'll be off, and they still have each other and they know what to do. So that for me was the thing.
Hi, I'm also a midwife. I was trained as a facilitator, but I never did any groups. But the thing that I had to overcome the usual barriers, but what really got to me were all the stories. Like, I love all the individual stories the women tell, the midwives tell. Like, they make me emotional every time, even thinking about it. The beautiful, beautiful stories the women have in the groups. And as from a professional point of view, like, what I always thought was so tiring as a midwife, the bloody little finger, how to convince somebody to stop smoking, and that that it goes in one ear and out the other, and that with centering you don't have to do that anymore, because you take a step back and your role changes completely. And I find that I've not experienced it myself, but I can imagine it must be such a relief not to have to be like this anymore, and to let the women take over and get to their goals by themselves or amongst themselves. Yeah.
Well, and I'll just say, Susan, that you are so passionate about women's stories that you put together a fabulous book, the Pearls book, that we will add the link to for the community of practice. So it's a fabulous book. Yeah. So, Jelana, do you want to reflect on this question of what appealed to you personally and professionally about group care, and what does still?
Well, I was going to say what does still is just listening to all of you and being like, oh, I feel that way, and also that way, and also that way. I mean, I think I was listening to Morwen's story about the women checking their blood pressure, and I really had that like a frisson, like a feeling inside that's like, oh, I could feel myself getting we would say like choked up about it feels very emotional to see people taking control of their own health. And then simultaneously listening to everybody's stories about what Jedidia had said about taking a step back, or listening to this transition that Margie's describing between thinking, and Marlies, thinking that you have the knowledge that you have to give to people, and also thinking about our own fear as midwives. I'm a midwife, and thinking about, like, what is it that I'm afraid will happen if I miss something, and what does that mean for, why is it that we are so afraid of missing something, of doing something wrong in some ways. And I think being in groups, for me, the thing that appealed to me was sort of a rebalancing of power, and that's something that I really strive for in my personal and professional life, is a redistribution of power. I'd love to also have a redistribution of resources, but let's just start with power. And I think, yes, so I think that's what drew me to groups. And I think, so just to Manoj and Esnath and Jedidia, is thinking about, there is a real fear that women or people, are not going to disclose, or are they going to disclose in groups, or are they going to feel safe enough to say things, and what are they going to say, and are they going to say the wrong things? And I think thinking about how, when I think about the larger mission of this community of practice, to sort of overcome some of that, I'd love to hear people's thoughts on how you communicate to people who haven't done group care, that it works, that it's that some of those fears are going to solve themselves. Anyways, I've banged on long enough, so I'll stop there.
I want to welcome Dr. Radia, and correct me if I'm mispronouncing your name, but welcome to this discussion. And if you'd like to share any reflections of what appealed to you, and what still does appeal to you personally and professionally, about group care.
Okay, thank you. Dr. Radia from Wajamama. So my reflection for the group antenatal care is seeing how women understand themselves throughout pregnancy, comparing to when they attend one-to-one clinic. So I'm in Zanzibar, and we are doing this group antenatal care in Zanzibar. So previously we are facing a challenge of low hemoglobin level, just because of lack of, how to make a woman aware of how important it is. But through group prenatal care, now we can see how it's bring about changes in their hemoglobin levels, and also how they know which is normal and which is not normal during pregnancy. And at some point, I can see how it is the group prenatal care influence and reducing, if not declining, the number of mortality and morbidity during pregnancy and for the newborn so far.
Thank you so much. Yeah,
thank you.
Very powerful. Thanks to everyone for your reflections. So we're going to go to the next question, which does have to do with the fears or personal challenges that you faced, but also how you've addressed those challenges in implementing group care. Just as a reminder, what I've heard so far in what everyone has said, are some of the fears that have come up are the fear of silence in the group, that women will come together but just sort of not want to say anything. A negativity in the community, lack of confidence, both on the part of facilitators, but also of the women themselves, the participants themselves. The fear of not being able to keep up, that you would miss something. And as professionals, you want to be professional, right? And not appear unprofessional. And that you would lose that professional sort of standing. So those are some of the things that I was hearing so far. How how do we address, how have you addressed any of those challenges or other challenges that you want to identify? Yeah, Dr. Radia, yeah, thank you.
Okay, thank you. So for the case of women fail to speak up or feel less confidence to discuss their concern, we have like sharing basket. So we encourage women who are not able to, to ask to use a sharing basket to present their concern. But also we are trying to make a friendly environment as possible so that to make everyone participating, because I know how the way we are conducting our group antenatal care, we want to make sure the women talk more so we can understand their concern than us presenting more. So we're trying to make a friendly environment as possible, but when it's not possible, that we encourage the use of sharing basket so that they can address their concern. So the major challenges we are getting is lack of support from the healthcare facilities, because we don't have a clinic which we are conducting. We are going to the facilities. We are training the reproductive health workers to run our group antenatal care, and sometimes use our own facilitators to facilitate the group discussion. So sometimes it's very difficult to encourage the healthcare workers in the particular facilities to organize or to run the discussion. So far we are going ourselves as Wajamama staff in various facilities to make sure that we are delivering the education and everything as required. And we are still encouraging them and training them to go through the discussion as it needed. So yeah, we're trying.
Can I ask just if you could go into just a little more detail of what that sharing basket looks like? How does that work?
Okay.
Hi. Sorry, I'm late.
Hello.
Hi,
welcome.
Thank you. Nice to see you all.
Would you like to introduce yourself, Nafisa, so everyone
Yeah.
knows?
Sorry, it's been kind of hectic, but I'm Nafisa. I'm the founder and CEO of Wajamama, also one of the main clinicians here. Sorry to arrive late, and I'm sorry for interrupting you.
So the sharing basket is basically a basket. It's at the middle of a group as we sit as a cycle. So it has paper, a pencil, a pen. At any time, a woman can take a pen and a paper and write anything they want if they can speak out loud in the front of audience. Yeah. So that's a sharing basket.
Okay, and then the facilitator will go in and grab a question once in a while. And is that okay?
Yes.
Okay.
And refer it back to the group so they can answer.
Okay, thank you so much.
Thank you.
Yeah, who else would like to share challenges and solutions that you've created?
Yeah, so for us, one of the challenges is high levels of or low levels of literacy among the women. So it was practically impossible or very negligible to have these sharing baskets because these women were practically not able to write. So what happens is the midwives kind of try as much as possible to collect as many consents during the 5-minute one-on-one, and then bring it back to the group session, and then they discuss it. Yeah. And then with regards to negativity, especially within the larger community, and then the whole setting as a whole, yeah, we kind of implemented in a very small rural urban area where, yes, there's a lot of negativity. People are very close. They don't really want to share a lot about their health data and all that, because they really feel it's something that they can be stigmatized with. So yes, we kind of saw it as a community project, which we tackle from all angles. We spoke, or we kind of engage all manner of stakeholders, right, from within the community into the hospital setting, and then the women themselves to buy their confidence, to get them to really direct as to how they felt comfortable for group care to be implemented. And it went a long way to get more women to enroll onto group care.
So working at multiple levels. Thank you, Judy. I really appreciate that. Yeah, who else would like to share? Again, this is in the spirit of sharing with one another, but also for people listening to this conversation to really learn from us.
I'm just curious for anybody else who's in areas with low or who's had experience with low literacy. I really, because we've the work that Octavia and I have done in the UK, where we're not having issues of low literacy, but what you're suggesting, Jedidia, about taking the questions from we've really tried to impress upon the midwives, I would say, haven't we, Octavia, taking back the questions from that from the 3 to 5 minute assessment and using them as a springboard for discussion, I think in the group is such a good idea. I just wondered if anybody else has other things that they've done for places that have other suggestions for that concern for low literacy situations.
That they did in the Netherlands with some groups. They set the agenda at the beginning of the session with the group, within the team or something, or within knowing the questions. So they did it all verbally. So what are we going to talk about today? What do you want?
And how can you say a little bit more, Marlies, about how that agenda gets set?
Well, so you could, as a midwife, you could say, like, okay, today we want to talk about food and nutrition and this. So are there any specific questions you have upon that we should discuss? And you have spoken them the first 5 minutes. So you would say, and there are some questions that are there, like what you did, Jelana. But you could have say, what are the more important things that we really need to discuss today? And then you set the agenda. That's how they do it sometimes.
Okay, thanks. So people know sort of what's coming up.
Yeah.
Yeah. It's not a surprise. Octavia, you took off mute. Yeah.
Yeah, I am. I don't worry so much about the challenges that everyone's mentioned, because I guess I've been training people to do this now for 8 years, and I just know it works. I've just seen it work too many times. I just know that women will disclose and midwives will end up liking it. Not that there aren't problems. Sometimes there's problems with recruiting and stuff, but the real challenges, but I know that if you do it and you support it well, I know it can work for not everyone, but most women and probably most practitioners. I think where our real challenges lie, and I've come face to face this on a personal basis quite recently, and it shocked me how exhausting it felt. Our real problems are dealing with our structures, how the NHS is structured, how this is perceived to be staff heavy at a time when we've got a lot of staff shortages, the fact that it's so difficult to access venues, and the staff shortage also feeds into the fact that midwives then don't have time to reflect on what they're doing, and therefore they go down rabbit holes and things can end up getting problematic because they haven't had time to regroup. And so I guess staffing and the perception, I don't even think it is more expensive in staffing. I know it's not, I've done the maths, but it's perceived like that way, in the same way that continuity of care is here. And it's difficult. So recently I was talking to someone about possibly starting this up in the trust where I work. And I know I can persuade them that this works, and the women will love it and all like the outcome, all that stuff. But the idea of the emotional work it's going to take for me personally to persuade them to give me the time and to give another midwife the time to do this and to help us find a venue and to support, a small amount of money for materials or whatever, food, whatever is needed. And I feel that would all be on me. And it was really funny when I was thinking, I spent, I've got 21 different maternity services in the UK to implement this. So I know how to talk the talk. And when it came to doing it myself, I really felt exhausted at the prospect of it. And I can see, and because of this, I can see why our sustainability has been so challenging. People start it, they love it, and then the minute they get any excuse, whether it's COVID or something else, they stop, because it's a big thing to get moving, and it takes a lot to keep it moving as well. And I'm not sure I've got the answers to that yet, although I hope some of the work we've all done will pave some of the way to that and get high level, push for implementation as well. But that, bottom up stuff only goes so far, because it is exhausting. Sorry, that was a long chat.
No, and it's so important, those structures, those, right, those mountains, those icebergs that have to be moved, even in the face of so much evidence of this is just better in so many ways, not just in terms of birth outcomes, but satisfaction, job satisfaction, patient satisfaction, etc. And yet, we still have to move mountains. So yeah, no, thank you, Octavia, for that. Esnath, I think you took your mute off, and if you want to share something from your perspective.
Okay, thank you. I just wanted to add on to say we also have a lot of women who with low literacy levels, and that's why our when we want to use the sharing basket, it's not usually utilized because people cannot write whatever question that they have. So what we have been doing is to encourage them to talk. Indeed, we have those that are introverts, that are very quiet, they don't want to contribute, especially the first contacts. But after some time, we see them opening up and discussing the issues freely. And even those sensitive and personal issues, you would never think that people would share in a group. You see the women coming up with them and then discussing them. And it has really helped. And when you always ask, our sharing basket is empty, why are you not writing? Say, no, we'll rather discuss everything as in a group. So that's how we use it. Yeah. And for the lack of less confidence of the midwives, because there was that fear that all what they knew before is to give information, give information. And for them to switch to just facilitate, have maybe powerful questions that can elicit more discussions, it was really a challenge in the first initial phases. But with time, because we have a facilitator's guide that has some of these questions that they would use for the topics that are, so the midwives have really improved in terms of facilitation skills. So that's what I just wanted to say. Thank you.
Thank you so much. So Marlies and Susa have put something in the chat. Do you mind if I read it? Or do you want to read it? Okay, I'll read it. It says, our national steering group.
Oh, it's a reaction to Octavia, actually.
Oh, to Octavia. Okay.
You can't do it on your own.
Yeah.
So we from the beginning, we worked with the midwifery organization, a research institute, the midwifery academy, and from these, the people that were really enthusiastic, they clung together, and some midwives from the field. But it was exactly these organizations that backed us up, that really made it possible, because they invested some money, they had other connections, they introduced, so it wasn't only us introducing it, it was like our back office also, that made a difference, I think. And it made that we could go on, because everyone got the press once in a while, but then the others weren't. So that was quite nice.
And they also had they also each had their own networks.
Yeah, find people with different networks.
Yeah. From Manoush, as someone who's run a hospital, who, your role, Manoush, has been so much in the structural piece. Any comments on sort of what we're talking about of structural challenges and how to get group care, into those structures in your experience in Suriname?
Yes, thanks. Yes, this is slightly moving away from, this is more like building the, facilitating it and the environment where group care can succeed. Yes, I believe what we facing, and maybe I'm talking more about Suriname, I'm not sure about other countries, is that the system of antenatal and postnatal care is very much specialist oriented or hospital oriented, if you want, and less midwife oriented. So I feel that there's a sort of additional barrier that we have to face about the system that we try to put group care in. Because in the group care system, the midwife, or if you want, the facilitator, is such a key person, and it's empowering the midwives, it's empowering the facilitators. But if in our language, the upper person, a specialist, a gynecologist, or a pediatrician, doesn't give the approval of what the midwife is doing or the facilitator, it's still sort of like a barrier. So I feel that if you want to have group care into your structure, you need to get them on board as well. You need to convince all healthcare professionals, not only the midwives, because usually the midwives love it. They love it. But there are others that you need to get there, because if gynecologists say, well, the midwife is doing something, I don't know what she's doing, sort of making this kind of remarks, it doesn't encourage women to go to group care sessions unless they really want it. So I feel that, you need all parties, all stakeholders into the discussions and convince them as well, maybe with your enthusiasm, but also maybe with the evidence that it works.
Thanks, Vinesh. Yeah, Jelana, I saw you were off mute.
I just was thinking that there's so many different levels of dealing with challenges in group care. I think, there's individual levels and structural levels, but certainly the structural level, they all sort of feed into each other. But I think I know Nafisa and Dr. Radia and Morwenna, I know that a lot of work has been done in Zanzibar, sort of building coalitions. And I think similarly what's happening in Suriname and what has happened in the Netherlands, so much of making this succeed is sort of getting the buy-in at every level. And in some ways, the easiest buy-in to get is the women, right? Once they've done it, then they're very great advocates for it. But it's sort of transmitting that knowledge up the chain and then working in a system where the satisfaction of women and pregnant people still isn't ever counting for enough, sadly, to make policy change. And I feel like that, and then on the next level, like the well-being of midwives, which we should all care about, doesn't also always rate quite high enough in various levels of the system. And that's why you have to, I think, use this sandwich approach of sort of top down and bottom up simultaneously, so that you create sort of a successful group care sandwich, so that everybody can take it on. But I think my hope is that this community of practice can in some ways facilitate people making connections, so that you can say like, oh, in the Netherlands, they did a great job of building coalitions this way, or Manoj in Suriname was able to get the hospital directors on board this way, or in Zanzibar, they've managed to get this off the ground in these three ways. Similarly, experience of running trials in Malawi and taking that information somewhere else in in both your neighborhood or elsewhere. I just think we have so much experience right here in this room of what works and what doesn't. And I think it's really important to keep those conversations going.
So Margie, I saw that you raised your hand. I do want to be respectful of everyone's time. We've got about 3 minutes left for the hour. So Margie, and then let's maybe do a round of wrap-up comments.
I won't talk long. I'll try not to anyway. One of the things that I found is that much like leading groups, I started off wanting to push the conversation and manipulate the conversation, and then I found that I could lean back and relax, and it wasn't up to me. And I think it works the same way as we try and spread group care over a large amount of space. You can push, you can be active, you can respond, you can do, but after a while, there's a sort of sense of, I can't carry this anymore, it's kind of heavy, so let me just lean back and see what emerges. And in my experience of all my years of teaching people to do groups and working with groups, is that emergence is where the next energy comes from. And it's not my energy, it's the energy of the midwives, it's the energy of the group. And then I agree with everything that everybody said about marketing and everything else. It's all important, but from a personal point of view, sometimes letting go and letting energy come, it'll work. That's it. And I love hearing from everybody. I'm so excited about group care.
This is really exciting. So let's do a round of any sort of final reflections that you have. And once I end the recording, if everyone wouldn't mind staying on for just another minute, because I want to check in about something. Okay, so who would like to start with final reflections on this particular issue of fears, challenges, and addressing those challenges?
I think the model is good enough that it will, I think it's already proved that it has a life. And I loved Margie's approach to leaning back. I just think it's too good to go away. And I think we will find creative ways of dealing with these individual challenges.
Thank you, Octavia.
Can I just follow on from that? Because what I'm so amazed to see, what started off as being really small from these couple of midwives that were doing it in the Netherlands, and if I see what is happening now everywhere, like you just finishing this amazing Horizon 2020 project. There's a lot going on in the UK. There's a lot going on in several African countries. There's people in Australia setting up a trial. Like, you know, the more it's amazing, really. So I know it's not going to go away. So that's something that, you know, that should give us so much energy to keep at it. That's what I wanted to say.
We be dead before group care.
Yes.
Jedidia, I see your hand.
Yeah, I think I agree with Malice that you can't do it alone. You will need a support system, and you need to carefully think about your support system right from the onset, such that you'll be able to always kneel on them. They'll be able to always give you the energy to be able to move on, because you will inevitably crumble if you want to do it alone.
So group care, showing once again the power of group, right? In every dimension, which is so powerful. Yeah, yeah. Anyone else? Isnat, Morwenna?
Yeah, I think I totally like what we are saying, to say group care is here to stay. We just have to have creative ways of scaling it up to places where they don't have, and also trying to solve the challenges that keep emerging, so that we promote the good health of our women. It is women have a positive experience out of group care than the individual care.
Thank you so much. Anyone else as we close out? Okay. Well, thank you so much. I'm going to stop the recording. But for those who are viewing this afterward, thank you for listening. And please stay in touch so that you can hear about our next series of discussions.